You go in for an MRI. You come out with a new piece of information that most people never have to carry. You have a brain aneurysm. And then your doctor says something that's meant to be reassuring. It's small. It's under 7 millimeters. We'll just keep an eye on it. And for most people, that is the right conversation. The 7 millimeter threshold is real, it's evidence-based, and it guides clinical decisions all over the world. But in June 2026, a research team at UC San Francisco published something that every patient carrying small aneurysm and every clinician managing one should understand. They mapped the cells inside the aneurysm walls at a resolution we've never had before. And what they found explains why some aneurysms, although they're small, may bleed anyway, and they destroy themselves from the inside. This episode is about what they found, these researchers at UCSF, what it means for you if you're living with a brain aneurysm, and one risk factor whose mechanisms just became impossible to ignore. Let's get into it. Welcome. I'm Dr. Estrada Bernard. I'm a neurosurgeon. Today is for two groups. First, anyone who has been told they have a brain aneurysm or whose family member has one and has been reassured that because it's small, it has a low risk and we can just keep an eye on it. I want to give you a more complete version of what low risk means. The second is neurosurgeons and trainees, especially those in places where they don't have a system that provides robust surveillance and counseling as a part of the daily practice. The new mechanism data is relevant to your clinical conversations with your patients. Here's a central idea. An aneurysm is a bulge in the wall of a brain artery. That wall is made of living tissue. You have cells, you have a structural matrix called collagen, connective tissue. And like all living structures, they can be healthy or they can be unhealthy and under attack. The 7 millimeter threshold for aneurysms tells you about the size. What it doesn't tell you is what's happening in the wall of the aneurysm. Those are two different things. The new research I'm talking about today tells us about the second one in a way we've never seen before. It is not a structural guarantee. It doesn't tell you what is happening in the wall of the aneurysm. It doesn't tell you that the aneurysm is small and strong. It tells you that across a large population, aneurysm of their size, of the small size, tend to rupture at a low risk. The aneurysm size is just one data point. What this recent research begins to show is that there are other data points, ones that reflect what's happening in the wall of the aneurysm themselves, that can indicate that the biology of the aneurysm wall is not healthy. There is a number your doctor can give you, and here's what it actually means. The 7 millimeter threshold for brain aneurysm management is real science. It's population derived. It guides treatment decisions across the world, and it's the right starting point. But it's a starting point, not a ceiling. It tells you about size. It doesn't tell you what's happening inside the aneurysm wall right now. Those are two different measurements. And for the first time, this recent research study gives us the science to understand the second one. Let's discuss this further. What happens inside the aneurysm wall? Let's talk about the science. Now, I want to walk you through what the UC San Francisco research scientists actually found, because the mechanism is both fascinating, it's elegant, but honestly is also alarming once you understand it. Interesting thing they found was a feedback loop, a cycle between two cell types that once activated begins to destroy the structure of the aneurysm wall. And that's independent of the size of the aneurysm. The two cell types are called macrophages and fibroblasts. And what are these? The macrophages are immune cells. They're supposed to be the wall, the cell wall's defense system. They clear out debris, they fight infection, they respond to damage. But in the aneurysm tissue, these researchers found that those macrophages, for some reason, can shift into a state of chronic destructive inflammation. In that activated state, they release a certain kind of enzyme, which is called matrix metalloproteinases. Big word. You don't need to remember that term. But what those enzymes do is important. What they do is they break down collagen. And the collagen, as I mentioned earlier, is the structural scaffold of the artery wall. Is what makes the wall strong. When the macrophages destroy the collagen, then the wall loses its strength. Under normal circumstances, the other cell type, the fibroblasts, they'll come in to repair the damage. They're like the construction crew. Their job is to make collagen and maintain the integrity of the aneurysm wall. But here's where that loop becomes dangerous. When the macrophages are activated into the inflammatory state, that activation leads the macrophages to impair the fibroblast function. So the construction crew itself gets disrupted by the very macrophages that they're supposed to help. The macrophages keep destroying collagen. The fibroblasts can't keep up with the repair, and the damage repair process gets out of balance. And so you have net destruction of the cell wall. And so what these researchers have identified is a mechanism for how the aneurysm wall becomes weak. And here's a critical point for everything that follows. This loop can be running in an aneurysm, whether it's 4 millimeters, 6 millimeters, or 10 millimeters. The size doesn't predict whether there's an active process of this activation of the macrophages. Now, I want to tell you about a significant risk factor that you can do something about. And it's harder to dismiss this risk factor. And I'm talking about cigarette smoking. I've already talked about this in previous episodes, but smoking is associated with brain aneurysms and their rupture. The data about this is clear. Smokers have higher rates of aneurysm formation, faster aneurysm growth, and higher rupture risk. A 2012 meta-analysis research study showed that current smokers face approximately 3 times the rupture risk compared to non-smokers, never smokers. But the mechanism, the specific biological reason why, has always been somewhat abstract. We knew that it happened, but we didn't know why. We talk about oxidative stress. We talk about endothelial, the lining of the blood vessel. We talk about them being damaged. We talk about inflammation. They're real processes, but they're not specific, and they don't give you the exact picture. What this recent study from UCSF does is to give you a picture of what may actually be happening. Nicotine, which is the primary bioactive compound in tobacco, is a direct activator of macrophage inflammatory signaling. There it is. Nicotine drives macrophages toward that exact activation state that this recent paper identifies as destructive to the aneurysm wall. It makes sense. It potentiates the fibroblast-macrophage feedback loop. It gets it going. Let me put that in plain language. Every time nicotine reaches an aneurysm wall, it's pushing the immune cells and macrophages toward a state of active collagen destruction. It's turning up the volume of that feedback loop. It's accelerating the process by which the wall loses its strength, its integrity, because it can't repair itself, because the fibroblasts which do the repair are not functioning well. It's a cellular mechanism, and it has implications for anyone who has a brain aneurysm, because smoking will raise your risk of it bleeding. You are actively supplying the fuel for the biological process that determines whether your aneurysm wall will hold up in structure. Here's what it does to the wall of your aneurysm at the cellular level. Inside your aneurysm wall, there is an ongoing conversation between immune cells and structural cells. Macrophages break down collagen. Fibroblasts are supposed to repair it. When this balance tips towards destruction, the wall weakens regardless of the size of the aneurysm. Nicotine drives macrophages towards exactly the destructive state that tips that balance. Every cigarette is biological fuel for the process that weakens the aneurysm wall. If you have a brain aneurysm and you smoke, this is the mechanism. This is why quitting smoking is not optional advice. It's the single most powerful thing you can do to slow down that biological process that puts you at risk for aneurysm bleeding. What does this mean for you right now? I want to end this episode with something concrete, because the value of understanding the mechanism is not academic. It's motivational. When you understand why something happens at the cellular level, the recommendations stop feeling like some cautious bureaucracy and start feeling like, I understand what's going on, and it makes sense. If you have a brain aneurysm, small, large, or in between, here are 4 things the new science tells you to do. 1, keep your follow-up imaging appointments. Surveillance is not just caution or theater. It's the only way to detect changes in size and shape that signals that something is shifting. 2015 American Heart Association and American Stroke Association guidelines have specific recommendations. They advise a first follow-up at 6 to 12 months after you find out you have an aneurysm, and then yearly or every other year after that. A 2025 New England Journal of Medicine review describes current practice as every 6 months until the aneurysm is stable, then every year. If it grows by 0.5 millimeters or more over 36 months, then you should be monitored more closely. The exact interval is individualized, but keeping the appointments is not optional. You have to keep it under surveillance to know if there's any change. Number 2, treat your blood pressure aggressively. Hypertension is the second major driver of macrophage activation in aneurysm walls. Blood pressure control is not just good cardiovascular hygiene, it is directly reducing one of the inputs that drives that destructive feedback loop that destroys the aneurysm wall. Number 3, if you smoke, use nicotine, stop. I have given you the mechanism. Nicotine activates the exact cellular process that destroys the aneurysm wall integrity. There's no safe level of smoking when it comes to the brain aneurysm. Stopping smoking is the highest yield modifiable intervention available to you. Number 4, know your aneurysm specific risk profile. Ask your neurosurgeon, what is my phases score? And he will know what that is. Are there morphologic features? Are there certain things about the shape? Are there daughter satellites that can change the risk calculation? Size is just one aspect to consider. Your doctor can give you the full picture. This research changes the conversation. It gives us a cellular vocabulary for something we have always known clinically, that two aneurysms that look identical on imaging can behave differently over time, even if they're both small. Some walls are stronger than others, and we haven't known why. But now we have evidence that some of these walls are under active biological attack, and we're beginning to understand why. This matters for you in a practical way. It means the modifiable risk factors your doctor has mentioned, blood pressure control, cigarette smoking, follow-up, they're not generic lifestyle advice. They're real concrete solutions that make a difference. And they're targeted at the mechanism that we can now see at the cellular level. Science doesn't move in sudden leaps. It moves by accumulation, by each study adding resolution, clarifying the picture that used to be more blurry. This recent study from UCSF added resolution to the aneurysm wall biology in a way that will change how researchers approach treatment targets, how clinicians counsel patients, and how we think about the gap between size and risk of bleeding. I'm Estrada Bernard. We believe that understanding your nervous system is one of the most powerful things you can do for your health. If this episode helped you understand something, pass it along, share it. Please put comments if you have questions. If there are topics you'd like for us to review in the future, please let us know. Interact with us so we can provide the information that empowers you. And as always, make healthy choices.